Hi, I'm going to talk about fibromyalgia today, and I want to talk about it because, as you know, fibromyalgia is hopeless and there's no cure, and there's nothing you can do for it but live with the pain. That's actually not the truth, and my experience tells me otherwise, and many of my colleagues have the same experience. So why is it that I here as a medical doctor am telling you fibromyalgia is curable, when most doctors will say, no, there's no cure for fibromyalgia, here, take these drugs or get some psychotherapy and do some exercise. Um, because modern medicine doesn't understand fibromyalgia, my understanding of why not is that in general we learn in medical school to think about one disease with one cause and one cure. And fibromyalgia is probably not fit into that paradigm. In fibromyalgia, there's a number of underlying physiologic disturbances, some of which are correctable, and those disturbances all interact with each other. So there's multiple different causes that are interacting in kind of a cyclic way. It's systems biology. We'll talk a bit more about that in a second. But if I am thinking and doing clinical trials around, let me find the cause and let me find the solution, then I'm going to miss the richness and the complexity of the problem, and I'm not going to be able to address it in a meaningful way. That's why some people say fibromyalgia is not a disease, because it doesn't fit that one cause, one disease paradigm. It's a set of physiologic dysfunctions that give the classic symptoms. What are the symptoms? Widespread pain, can't sleep despite being exhausted, a lot of gastrointestinal problems and irritable bowel. There can be thermoregulatory problems like sweating for no apparent reason, funny symptoms, can develop nerve pain, various kinds of things like that. So what's the underlying reasons? And I say reasons with an S because there's a multiple physiologic disturbances that research has shown in the last 10 or 15 years about fibromyalgia. Let's talk briefly about them. One of them is alterations in our hormonal stress system. The hypothalamic pituitary adrenal axis, or the HPA axis, that's this incredible feedback system between our brain, our adrenal glands. It influences our thyroid gland, it influences our sex hormones. It's our overall integrated hormonal system of our body that gets out of whack and kind of blows a fuse, and that seems to be related to chronic overwhelming stress over a long, long time. So hold for a second, because stress is much more complex than you might think. We're not just talking about, oh, I'm late for work and I'm hurrying. We're talking about fundamental physiologic stress, which can be emotional, it can be biochemical, it can be physiologic, it can be external from the environment. A lot of different things create stress on our system. And depending on our genetics and our life experience, that stress response system that we have inside of us, which is meant to help us adapt to change and adapt to new circumstances, it goes on overdrive and then it blows a fuse and gets dysfunctional. So that's one thing, HPA dysfunction. Another thing is chronic inflammatory changes. What does that mean? It doesn't mean the inflammation that my father learned about in medical school. It means the inflammation that we're learning about now, which is chronic, low-grade, quiet changes in the biochemistry that drives inflammatory changes. It's subtle. It's not red, hot, swollen, painful inflammation like we normally think about in medicine. It is increase in cytokines, which are biochemicals like interleukin-6 and tumor necrosis factor that drive certain physiologic changes in the body, and they create something that's called oxidative stress. Oxidative stress is what happens when the immune system is overactive. Together, chronic inflammation, oxidative stress, and other things lead to one of the third things that we know happens in fibromyalgia, which is dysfunction of mitochondria. Mitochondria live inside of our cells. They produce energy. They're the power plants of our cells, and they get dysfunctional in fibromyalgia, and that's part of why so many systems seem to get dysfunctional. Mitochondrial dysfunction, if you look in the current medical literature, the stuff that that most doctors don't hear about for 20 or 30 years, it's in the medical literature now, and it's telling us that mitochondrial dysfunction underlies and seems to be related to a lot of chronic illnesses, not just fibromyalgia. That's a whole other topic, but it's part of the fibromyalgia picture. Let's talk about other underlying causes with fibro. Gastrointestinal disturbances. There's a phenomenon called intestinal permeability. It's also called leaky gut. When I was in medical school, that was kind of a joke that we used to laugh at because, well, whatever. Now it's actually in the mainstream medical literature talking about intestinal permeability and how it leads to various changes inside our gut that activates the immune system that surrounds our gut, and it drives inflammation. What else is on the list here? Teleprompter. Chronic infections, various things that can be going in the body driving inflammation. And then there's something called small fiber neuropathy that's been discovered lately, which is basically like the tiny little nerves start to break down. Those might start to break down because of some of these other problems that we've discussed, such as chronic hormonal dysfunction or oxidative stress, as well as mitochondrial dysfunction. Those can lead to or influence small fiber neuropathy. And small fiber neuropathy, where the tiny little nerves stop working properly, can be driving chronic pain all over the body. It can be driving a lot of the sort of disturbances in basic functions like temperature regulation and sleep and all of these different things. So complex underlying physiology that gives rise to the symptoms and signs of fibromyalgia. So part of the question is, well, what do we do about it? Before we go there, let's just make sure we get a couple of main points. The first point that I wanted to hope you all got is that there's a bunch of different things going on. Imagine hypothalamic pituitary adrenal dysfunction and mitochondrial dysfunction, stress axis, hormones, gut dysfunction, inflammation. They all relate to each other. It's kind of a vicious cycle of different things happening. And you can have various different inputs causing that depending on the person. For one person, their early life was full of stress and trauma, or maybe they had another person had multiple infections and got lots of antibiotics, and it threw off their entire biome, which is the sort of regulatory bacteria that live inside of our gut. Another person had serious viral infections. Another person got in 7 car accidents. Somebody else had an autoimmune disease. So a lot of different inputs can lead to this constellation of physiologic dysfunctions, which is why we can't find a cause for fibromyalgia, because we've got a lot of different causes. And so it diffuses the research. Hope that makes sense. We want to recognize that stress is a very broad concept. It's not just mental, emotional stress. That can be part of it. But the way your organism, the body, experiences stress, it can be mental, emotional stress. It can be biochemical stress from metal poisoning or from other toxins in the environment. It can come from overwhelming physical activity. Somebody who runs marathons and does way too much physical exercise can actually develop some of these physiologic changes. Electromagnetic energetic changes, various kinds of things can stress the system. Internal changes like chronic inflammation, these are all stressors, and in fibromyalgia, the body's capacity to deal with internal and external stressors is overwhelmed, and that's why people tip over when they try to do things, because their system's overwhelmed. What else I want to say here, bear with me a second, I just don't want to miss the main points. Let's go into what we want to do about it, because we want to make this a short video. The first thing is trying to understand if there's any identifiable causes in the most simple way. Because I have people come to me and they say, I've got fibromyalgia, and I do some blood tests and I find out, you know what? They've got an inflammatory disorder. They've got an elevation in their blood chemistry that shows inflammation, and so that needs a workup and may need some sort of specific treatment for the inflammatory disorder. I've seen other people who have like a vitamin B12 level that's incredibly low, and that throws off all their neurologic function. We replete the vitamin B12 and they feel better. Similar things with magnesium, vitamin D. You got to make sure the basics are in place. Some people have chronic hypothyroidism, but it's not showing up to their primary care doctor, because we're understanding thyroid is more complex than just whether the TSH, the thyroid stimulating hormone, is normal or not. Some people have disorders in the way the body converts thyroid hormone, and the TSH doesn't show that. And so we have to look critically and carefully at the physical exam and other aspects of the picture and try to understand, well, what's really happening, and let's take a look just biochemically with standard biochemical tests that any doctor can do, but not all doctors know how to interpret properly because they're not thinking about a multifactorial problem. That's the first step. The second step is a deep dive, which is the basic of a functional medicine evaluation. A patient comes in and I want to know what happened starting at birth, maybe even before birth. What's going on in their family history? Are there people with chronic pain or other disorders that suggest an inclination or a tendency to develop a chronic pain syndrome? Are there early life stressors? Are there early life illnesses or injuries or other things that can set the system up? We call those antecedents. Then we ask about triggers. Triggers are, when did you first start feeling the symptoms? Well, doc, you know, I had a really bad case of mononucleosis when I was 22, and I was wiped out for 2 months. I kind of gradually got better, but then, you know, when I was 29, I got in that minor car accident, and I had a bunch of neck pain, and boom, I just tanked, and I started developing all this pain. Okay, so that mononucleosis is a clue. People can have chronic infections with Epstein-Barr, or Epstein-Barr, which is what creates mono, can generate a shift in the biochemistry and a shift in the inflammatory mediators of the body that sets things up because it generates oxidative stress, and then you get a mild trauma or another illness, and boom, the system tips over. So we do a really detailed history and we look for clues for what part of the physiology might be imbalanced or out of whack. And from there, we do treatment. Before we talk about the treatment, there's another thing I want to share, which is that the functional medicine approach is challenging. It takes a bunch of time. I sit with people for an hour and a half and do a really detailed history. And then when we determine what's going on, the patient's got to take a lot of responsibility. There's a lot that's about lifestyle that can be changed. We're talking about diet, nutrition, stress, the right kind of exercise, the right kind of hands-on treatment, the right kind of mind-body therapies that can evoke a quiet stress response, that can generate a relaxation response, that can generate the biochemistry of healing. Those are important, powerful things, and not everybody has the time or resources to do that. Some people come to me and they say, look, I can't deal with this right now in my life. What can you do for me in the short term? For some people, they actually benefit from something that I prescribe quite a bit called LDN, or low-dose naltrexone, and that's a simpler approach. There's other vids on my website and Facebook page that talk about that, but that's a simpler approach than going down this functional medicine pathway, and for some people that's what's best for them. Some people want to do the LDN, but they also say, well, what are the best supplements to take? And there's a few things that are relevant for fibromyalgia. I'm not going to go into the details about that now, but there's a few things that are helpful because they're relevant for pain, they're relevant for reducing stress, they're relevant for helping sleep, and they can be kind of done in a simple one-off way, and some people that helps them, and that's enough. But not everybody. Some people have tried those things, and they come to me and say, look, I tried LDN, or maybe I didn't, but I tried taking fish oil and curcumin, and I tried taking vitamin D and magnesium, and I tried taking L-threonine and melatonin, and I still feel horrible. What do I do? And of course, Lyrica doesn't help me, and I can't sleep, etc., etc. That's where the functional medicine deep dive matters, because we go in, we do this exhaustive, detailed history, a really careful physical exam, and sometimes special testing depending on what the history says. Some of that special testing is available through the health plans, some of it's not, and it has to be done through private functional labs. Those are things that give a broader, more subtle snapshot about what's really going on in the hormonal system of the body, in the inflammatory system of the body, in the detoxification system of the body, and the neurotransmitter synthesis. It helps us see if there's changes in the biome or other sort of infections that might be going on chronically and driving inflammation and driving the problem. So we dive into that, and then we make a plan together, and that plan is frequently very lifestyle oriented. Imagine I've got 3 circles here, and they're intersecting, 3 concentric circles. There's 3 M's, those are the 3 circles. 1 M is called metabolic, or biochemical. 1 M is called mechanical, or movement. It's your mechanical structural system of your body, from your bones and muscles down to your cells. Another M is the mind system, the mind, emotion, spirit aspect of you. Those 3 M's meet, and where those circles meet, that's where the action happens. That's where your reality and your health is. All 3 M's are relevant for chronic illnesses, especially fibromyalgia. We got to get the stress axis quieted down because almost everybody is stressed out. Their lifestyle, their thought patterns, their beliefs, old traumas. There's a whole set of different techniques that have been proven to be useful to reestablish a balance in that stress relaxation response of the body, and that's a foundation of helping that hypothalamic pituitary adrenal system heal. It's also a foundation for helping a person be able to think clearly and make good decisions and walk through the world in a way that isn't ongoingly horribly stressful. That's the mind aspect of it. The mechanical structural aspect of it. Fibromyalgia, there's a lot of physical pain. Somebody who's got chronic arthritis or chronic myofascial pain with muscle spasms or a chronic sprained ankle or an old neck injury, that focal place of injury and irritation and noxious neurologic signal is going to get amplified by fibromyalgia and cause a lot of pain together with everything else. So the right hands-on mechanical therapies or acupuncture or movement therapies, things people can learn to do on their own, like Feldenkrais, Tai Chi, yoga, Pilates, various kinds of movement arts that involve aware, careful movement with attention to balance and focus and quieting the mind. Powerful, powerful tools. Then there's the metabolic piece, like how do we help the metabolic system heal? And that's as wide as all of integrated medicine, because for some people, they've got a parasite in the gut, and that gut is driving inflammation, and we got to cure the parasite. People talk about using botanical things to cure parasites, and for some people that might work fine, and that's a decision I have with the client, with the patient individually, like, do we want to for sure knock this thing out with some appropriate anti-parasitic medication, or do we want to do things that are botanical? And it's a choice, it's a value judgment. We figure that out. That's one aspect, is dealing with infections or colonizations that could be relevant. Another aspect is making sure the hormonal picture is in good shape. For some people, lifestyle can shift the hormonal picture, like we talked about a bit with the mind-body stuff. There are certain supplements that actually can help balance out the adrenal glands. There's certain nutrients that can help the thyroid gland function more effectively. Some people actually benefit from having hormone replacement at low levels appropriate to the circumstances to give a little bit of support for their hormonal system. Moving on to sleep, because so many people are sleep deprived, I tend to encourage people to use non-pharmacologic methods of helping sleep. There's a bunch of different ones there, but sometimes low doses of pharmacologic sleep agents are really helpful together with the botanical ones, and what you end up with is using a few different agents at very low dose, so the very sensitive people who often have fibromyalgia don't get thrown off and don't get side effects. So that's a little bit of the picture. That's really an introduction. I hope I've given an overview that makes a certain amount of sense. The main messages I want you to walk away from this video with are, in many cases, fibromyalgia is healable and curable. In order to do so, we have to think more deeply and more comprehensively in a multifactorial way about the body and the mind together. We have to think about the 3 M's, the mind, mental, emotional aspect, the metabolic biochemical aspect, and the mechanical structural aspect, because those 3 are all interacting together to make up your reality of health or illness. So I wish you all the best. Tune in again later. Thanks for watching, and I'm Andrew David Shiller.